Coronavirus is prominent in major metro areas right now, but rural hospitals all across the nation are preparing for a potential surge of new patients. Our Washington correspondent Matt Knadler is pressing lawmakers to see how they're helping smaller communities during the pandemic.
Although the coronavirus hasn't severely hit rural areas like central Pennsylvania, Congressman Keller knows it could. He, like many lawmakers, spent last week's recess visiting small medical centers in his district, making sure they can get the equipment they need as the pandemic spreads.
We have a great system of delivering health care, and I'm confident that we'll be innovative and our healthcare providers will do a good job.
Innovation may be key, but so is federal funding. Last week, the American Hospital Association urged Congress to provide $100 billion in the coronavirus stimulus package to cover increased costs for care and personal protective equipment, noting the nation's 2,000 rural hospitals will not be able to absorb these costs on their own over a long period of time.
47% of the nation's rural hospitals are operating at a financial loss. That was before the crisis.
Pennsylvania Congressman Glenn Thompson worked in healthcare for 28 years. His district borders Keller's. Geographically, they are the two biggest in the state, both with large rural populations.
Our rural hospitals have gone through some difficult and challenging times with some of the healthcare changes. At the same time, I want our rural hospitals to know that we're deploying resources and dollars out of Washington.
The coronavirus also comes as more rural hospitals close their doors. In all, 126 shut down over the last decade.
But rural America is older, sicker, poorer. Greater percentage of elderly. These are the populations most at risk for this virus.
That's a real concern in places like Hawaii, where residents on certain islands may not be able to travel to the capital, Honolulu, for care. In all, the state has 9 critical access hospitals and 11 rural health clinics for nearly 1.5 million residents.
We don't quite yet know what the impact is here unless we get to that point where we start testing mass numbers of people.
In Washington, Matt Knadler, Erie News Now.